Good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Sébastien Tremblay, and I will be your moderator. Je m'appelle Sébastien Tremblay et je serai le modérateur de ce point de presse. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Mayor Jim Watson, followed by Councillor Keith Eglai, Chair, Ottawa Public Health Board, le conseiller Keith Eglai, président du Conseil de santé d'Ottawa, la docteure Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, Anthony DeMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, and Dr. Stéphane Roux, Chief of Staff with Hôpital Montfort, médecin-chef Hôpital Montfort. Available for questions from the media, following the statements, we also have disponible pour répondre aux questions des médias. Nous accueillons aussi Shelley Van Buskirk, Associate General Manager, Recreation, Cultural and Facility Services, Directrice Générale, Service des loisirs, de la culture et des installations, Donna Gray, General Manager, Community and Social Services, Directrice Générale des Services sociaux et communautaires, and Roger Chapman, Director, Bylaw and Regulatory Services, Directeur des Services des Règlements Municipaux. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Good afternoon, bon après-midi. I'd like to begin by extending condolences on behalf of City Council and all residents of Ottawa on the passing of Prince Philip, the Duke of Edinburgh. The Duke visited Ottawa on 22 occasions, both official visits and private visits. And the flags at all city buildings will fly at half-mast to mark His Royal Highness's passing and will remain at half-mast until his funeral. An online book of condolences is also available at ottawa.ca. Wednesday's announcement by the Government of Ontario to impose a 28-day stay-at-home order was undoubtedly a difficult yet necessary decision to protect all residents from the continued rapid spread of COVID-19 in our community. We have seen the number of positive cases, hospitalizations, and people in ICU increasing steadily over the last few weeks, and obviously this is of great concern to all of us. I want to remind residents that we need to follow the provincial regulations. It is essential that we do so if we want to crush this third wave once and for all. We fully understand that we have been living with COVID-19 for more than a year now, and these restrictions have been very hard on all of our residents. Nous avons tous fait plusieurs sacrifices au cours de la dernière année. Many have missed celebrating milestone birthdays with their loved ones. Kids and parents have had to reinvent the way they go to school, soccer practices, art lessons, dance lessons, and the like. And I know we're all exhausted by the constant changes over the year. But we cannot let up now because the end is, in fact, in sight. Nous devons maintenir nos efforts pendant encore quelques mois, comme la fin de cette pandémie approche. I can confirm that the city's Bylaw and Regulatory Services Department will ensure that the new rules are enforced over the next 4 weeks so that we can finally enjoy a more normal summer and fall. To alleviate some stress for those forced to work from home, and parking on residential streets, bylaw officers will suspend their proactive enforcement and will only respond when a complaint is received. And as announced yesterday, to support curbside pickup for our hard-hit downtown businesses and restaurants, we're reinstating free parking for a maximum of 30 minutes at the city's 3 gate-controlled parking garages, 2 located in the Byward Market and 1 located at City Hall. Please note that a parking fee will be applied after 30 minutes to ensure that the garages are only used for curbside pickup. Things have been extremely difficult for local business owners who are doing everything they can to make ends meet. I once again want to encourage residents to support Ottawa's small businesses in any way they can, but please do so in a COVID-wise way. Order takeout from your favorite restaurant, support your favorite local shop by ordering from their website, or purchase gift cards for loved ones from your favorite local store or service. Nous devons tout faire notre part pour appuyer nos petites entreprises locales. Our local businesses give so much to our community year in and year out, and now it's our turn to return the favor and help these people while they're down but not out. I know that Anthony Damati will be discussing in more detail, but we are continuing to make good progress with the administration of vaccines here in Ottawa. To date, we have administered over 186,000 doses of vaccine to Ottawa residents. We're pleased to hear from the province that more than 30 pharmacies are being provided with AstraZeneca, but we remain concerned about some geographic gaps in coverage. As a result, I've sent a letter to Dr. Homer Tien, operational lead for the COVID-19 distribution task force at the province, requesting that additional pharmacies in Ottawa, particularly those in areas like Vanier that were originally overlooked, be added to the list to receive the AstraZeneca vaccine. I look forward to hearing back from Dr. Tien as soon as possible to rectify this situation. Ottawa, as we all know, is a very large geographic piece of the province. Nous devons assurer que tous les quartiers puissent avoir accès aux vaccines. Every vaccine administered is potentially one more chain of transmission broken, and it could mean one less person in the hospitals. At our end, the city will continue to get these vaccines out as quickly as we can. For more information regarding COVID-19 and its impact on city services, I encourage you to check the City of Ottawa's and the Ottawa Public Health website and social media channels, and to sign up for our COVID-19 vaccination e-subscription newsletter to get the latest updates. I'll now ask Keith Eglai, the Chair of Ottawa Public Health, to offer comments, and then we'll hand it over to Dr. Etches. Merci. Thank you.
Thank you very much, Mr. Mayor. Hello, bonjour, Quay, and thank you all of you for joining us this afternoon. As the Mayor stated, we know this last week has been difficult for everyone. With the provincial lockdown last week, to the stay-at-home order announced earlier this week, we have been asked to be adaptable as our healthcare system tries to respond to the increased levels of COVID-19 in our community. It has been a very long year, but now, more than ever, it is important for each and every one of us to take personal responsibility and do what we can to protect ourselves and those in our community. That means paying close attention to our behaviors and following public health measures. And if you are eligible for a vaccine, please register to get it. After the province had announced that those 55 plus were eligible to book their appointments at pharmacies and to receive the AstraZeneca vaccine, I was so grateful for the opportunity to book my own appointment. After hearing that my age group was eligible, at the age of 59, I reached out to a local pharmacy and took the first appointment slot I was offered and was able to get my shot. It was fast, easy, and I've been lucky to only have some mild side effects of a sore arm. While I am now vaccinated, it does not mean that I should socialize with people outside my household without wearing a mask. While I am protected against severe illness as a result of COVID, I could still get sick and transmit the virus to others. Even after you get vaccinated, you should still wear a mask, practice good hand hygiene, stay at least 2 meters away from others, and stay home when you are feeling sick. If you, like me, have been reading in the news concerns about the AstraZeneca vaccine, please know that Canada's leading medical and scientific experts have determined that for persons 55 years and older, the risk of a serious outcome from being infected with COVID-19 is far greater than the risk of a serious side effect from the AstraZeneca COVID-19 vaccine. Health Canada continues to reassure Canadians that the AstraZeneca COVID-19 vaccine continues to be safe and effective at protecting against COVID-19 and encourages people to get immunized with any of the COVID-19 vaccines approved in Canada. In studies of the effectiveness of the AstraZeneca vaccine, it is essentially equal to Pfizer and Moderna in protecting against hospitalization and death. So please, if you are eligible for a vaccine, book your appointment today. Before we hear from Dr. Etches, I would also like to mention that the City and OPH have been made aware of unauthorized callers offering vaccination appointments. The callers ask for personal information and pretend to arrange a COVID-19 appointment or test. Please note that Ottawa Public Health will not call you directly about a vaccine appointment unless you have asked for a callback. If you're an adult recipient of a chronic home health care, you may get an automated call with a recorded message to let you know you are eligible to book a vaccine appointment. Some physicians and community partners may be calling to encourage you to book an appointment as well. In all cases, you should only book and give personal information through official sites and phone numbers listed on the city's website. Ottawa Public Health will never ask for money or your social insurance number. Neither appointments nor vaccines can be bought or sold by members of the public. I encourage everyone to sign up for the City of Ottawa's COVID-19 Vaccination Updates e-subscription, available on the city's website, to get the latest updates when the vaccines become available. Thank you.
Well, it's over to me. Good afternoon. I think, as you know, my voice isn't at its usual strength, but it is the case that I have had a negative COVID test and I'm feeling fine. I want to take it as a reminder, though, that everybody does need a break and to look after ourselves when we're not feeling well. So I do plan to have some time off with my children over spring break as planned in the near future. So what I wanted to emphasize is that, as I indicated to the province on Monday, the COVID situation in Ottawa is extremely concerning, and we do need further restrictions to bend the curve. We will hear hospitalizations at an all-time high. Younger people are being admitted to hospital. More people than ever are testing positive for COVID-19. We're no longer able to maintain the contact tracing except in higher risk settings like schools, healthcare, and congregate dwellings. And the variants of concern are making up a majority of the virus in Ottawa's wastewater. So we're seeing transmission across Ottawa. It is not limited to particular neighborhoods or geographies. We're seeing it in a variety of workplaces, restaurant patios, break rooms, after work gatherings, parties, carpools, sleepovers. So it's simple. The risk exists wherever people from different households gather and protective measures are not followed, namely that physical distancing and masking. Le risque existe chaque fois que des personnes de différents ménages se ressemblent et que les mesures de protection telles que la distanciation physique et les masques ne sont pas suivies. I want to remind everyone this virus is tricky. Not everyone with COVID-19 will have symptoms. And that's why, even if you're feeling fine, you still must follow the prevention measures in place. And when you're around others outside your households. So that includes people we know and love, our friends, our extended family, our colleagues, and neighbors. Même si vous vous sentez bien, vous devez quand même suivre les mesures de prévention en place lorsque vous êtes près d'autres personnes de l'extérieur de votre ménage. Même si ce sont des personnes que vous aimez, à qui vous faites confiance, vos amis, votre famille élargie, vos collègues, et vos voisins. So I'm going to turn to talk about schools. I know there are people with a lot of questions. And one of our main goals has always been to keep schools open. There are harms associated with closing schools. This includes impacts on mental health for all members of the family, stress, and financial impacts for parents and caregivers who can't afford childcare, and developmental impacts on children and youth who miss out on important social connections. So it's therefore with a heavy heart that I am now thinking the probability that schools will close to in-person learning after the spring break is higher than the probability that the COVID-19 situation will improve in time to keep schools open. La probabilité que les écoles fermeront pour l'apprentissage en personne après les vacances de printemps est plus élevée que la probabilité que la situation de la COVID-19 s'améliore à temps pour garder les écoles ouvertes. My heart is heavy because I know how important schools are to the health of our community. There have been new school outbreaks this week, but the overall number of outbreaks has remained fairly stable, and it's still a minority of schools that are affected by people testing positive. Our public health and school staff are working hard to manage the growing number of people exposed in the community who are then positive in schools. The situation with transmission of COVID in schools is not out of control, and we do see that people testing positive are in the vast majority of cases associated with someone who's been positive in the community. However, the context has changed this week, which includes the level of COVID-19 in the community continuing to grow to levels higher than we've ever seen. It's demonstrated by the wastewater signal, again, in a steep climb throughout this week. And the percent of people testing positive has reached new heights in adults, with some people having to wait now to access testing appointments. These statistics are concerning. And also, a provincial stay-at-home order came into effect yesterday. So this closes the malls and the places where children and youth might have gathered, if not in school. And so that risk of the gatherings outside of school is mitigated. So it does lead me to give notice of a school closure being more likely than not following the spring break, as we need to do everything we can to turn this curve. The team's going to continue to review the situation, but we will provide confirmation of the direction, a decision about school closures after spring break by Wednesday of next week at the latest. Other countries have consistently added school closures to strict lockdown measures to bring the numbers down. And closing schools will underline the seriousness of the situation, and it will assist people to stay home as much as possible, reducing mixing of students before and after school. La fermeture des écoles soulignera la gravité de la situation et aidera les gens à rester à la maison autant que possible, réduisant ainsi le mélange des élèves avant et après l'école. So in addition to the new provincial restrictions, I'm also issuing a letter of instruction to all employers, businesses, and organizations permitted to be open to take additional measures to reduce the spread of COVID-19, effective April 10th at 5 in the morning. J'émets aujourd'hui une lettre d'instruction demandant à tous les employeurs, entreprises et organismes qui restent ouverts à prendre des mesures supplémentaires pour réduire la propagation de la COVID-19. Ces mesures prennent effet à partir du samedi 10 avril à 5 heures du matin. Bear with me here. The new measures include increased reporting requirements when 2 or more people test positive for COVID-19 within a 14-day interval in connection to the workplace. Also ensuring that all employees are aware of any benefits and or pay to which they might be entitled in the event that they must self-isolate. And requirements to actively monitor and manage capacity limits in businesses and physical distancing and masking in outdoor lineups as people wait to access the business. At minimum, one staff person must be designated to monitor and manage the applicable capacity limit and verify compliance with physical distancing and mask wearing requirements of individuals in lineups. So documentation of how the workplace will do this is going to be required in their workplace COVID safety plan. There'll be full details of this letter on ottawapublichealth.ca. turning to the discussion about high priority neighborhoods, I think that there has been some confusion around the terminology of hotspots and the province identifying forward sortation areas, or FSAs, as hotspots, including here in Ottawa. So the province has announced extension of vaccine appointments at the community clinics in Ottawa to residents aged 50 and older who live in certain hotspots by their postal code. And this is happening in Ottawa. This is possible through the provincial booking system. I would say and as the medical officer of health, I have the authority to further focus on neighborhoods, which is based on our local data, which is more fine-tuned. So we are continuing to focus on neighborhoods where we see that the COVID levels are at the highest risk. And so we will continue to focus on these neighborhoods that we've already been naming and working in. We're going to continue the pop-up clinics. We're adding in walk-in options, mobile strategies, lots of different ways that people in neighborhoods will be able to hear on the ground are available for them to get vaccine when they're 50 and above. So our primary goal is to protect people at risk for hospitalization and death as a result of COVID-19. And this strategy of still focusing on people 50 and above, 60 and above across the city, 55 and above in pharmacies, and 50 and above in neighborhoods at highest risk is what will help with hospitalizations, because we still see the majority of people in hospital are over age 60 and over 50. In addition to the neighborhoods of focus in phase 1, the city and Ottawa Public Health, we continue to review data about other neighborhoods that may also be disproportionately affected by COVID-19, and we'll continue to adapt support for communities where we see the need. So you've heard that the COVID-19 response is being referred to as a marathon, not a sprint. And we can see this. We can see this now. We've been sort of in training for more than a year. We're tired. We're fatigued. We want this to be over. And this is the point in our COVID marathon where we're hitting the wall. But this is our defining moment. It's a moment where we've got to break through that wall and take one more step at a time. The moment we dedicate each step, forward is getting us to the end, and we will not give up. We won't fall. Nous n'abandonnerons pas. Nous persévérons. Vaccines are our fuel, and so are our behaviors. So those together will get us across the finish line. Thank you. Merci and miigwech.
Thank you, Dr. Etches. Just a reminder to please remain on mute until I invite you to ask your questions. We will now go to remarks from Anthony DeMonte.
Thank you, and good afternoon, bon après-midi. The province has declared a state of emergency and enacted a stay-at-home order across Ontario. We have seen COVID-19 cases rising steadily in Ottawa, and we need your help to bring these numbers back down. Le nombre de cas augmente de façon constante à Ottawa, et nous avons besoin de votre aide pour les faire diminuer plutôt à nouveau. The purpose of the stay-at-home order is to keep people at home as much as possible and to stop the spread of COVID-19, preserve hospital capacity, and save lives. We are asking residents to please follow this order and only to go out for essential purposes, to go to work, for groceries, for medical appointments, for medications, or for exercise. Nous demandons aux résidents de respecter le décret ordonnant de rester à domicile et de ne pas sortir pour des raisons que essentielles, comme pour aller travailler, pour faire l'épicerie, pour se rendre à des rendez-vous médicaux, pour acheter des médicaments à la pharmacie ou pour faire de l'exercice. We are reviewing the new provincial orders and we will enforce them accordingly. Bylaw and Regulatory Services remains committed to helping reduce the spread of COVID-19 to ensure the health and safety of our community. Although we're in another lockdown and we know that it's difficult for everyone in the city, I want to provide you some good news today. There is hope. We are taking tremendous steps forward in our vaccine rollout. Nous continuons à faire des progrès par rapport à la vaccination. More than 180,000 doses of COVID-19 vaccines have been administered in Ottawa to date. And here are some encouraging statistics for our most vulnerable. We have reached 87% of our 90+ residents with at least one dose and continue to do this work. Nearly 85% of all 80 to 89-year-olds have been completed, and 62% of 70 and 79-year-olds. These numbers don't include the tens of thousands of more people who already booked through the system to receive their vaccine. Every week, we are seeing more vaccines being delivered, and we're pleased to hear Premier Ford's announcement on Tuesday that Ontario is now entering into phase 2 of its COVID-19 vaccination plan. We've come a long way since we last started in December when vaccination started for our most affected residents. Operations are ramping up again, and we are working with school boards to start vaccinating some 3,000 special education teachers next week. We are also working to reach homebound residents who are receiving chronic home health care. Together with our partners, we will be bringing vaccinations to the residents who are unable to leave their homes. We are sending 11,200 doses of the AstraZeneca to 12 community health centers and family health teams. These partners will need some time to ramp up to start delivering these doses, but they will be a key player in our effort to make vaccine more accessible to everyone going forward. We continue to help vaccinate members of the Indigenous community through our partnerships with Wabano Center for Aboriginal Health and the Akusavik Inuit Family Health Team. We also continue to work closely with our partners at the Ottawa Hospital and Queensway Carleton Hospital to deliver vaccines to thousands of local healthcare workers. And as Dr. Etches mentioned, the province has identified 3 postal code areas that are hotspots for our residents over 50 years of age, and booking began for those sites this morning. While available appointments in the system are booking up quickly, we expect more doses to be confirmed in the coming days. We are also continuing to focus on the high priority neighborhoods that we previously identified and serve through our temporary pop-up clinics. Now we expect to have supply to allow us to go back to these neighborhoods and set up pop-up clinics for residents and essential workers who are 50 years of age and over in these priority areas. In fact, we are starting this weekend with a hyper-focused micro pop-up clinic in the Ledbury Heron Gate Ridgemount to reach community that has been disproportionately impacted by COVID-19. The message I'm trying to convey to all of you is that every day we're reaching more and more people. And as vaccine becomes available, we continue to put that vaccine into people's arms. Every day we are giving more and more access. And I want to close by recognizing the work being done by everyone involved in our vaccination rollout administration, our multiple partners, and everyone across the team. This is a huge undertaking, and one of the biggest we've ever tackled. I'm very proud of the work our team is doing. I also want to thank residents for their continued patience and understanding as we continue to make our way through this challenging time. Merci beaucoup. Thank you.
Thank you, Mr. Demonte. We will now hear remarks from Dr. Stéphane Roux.
Yes, good afternoon, everybody. Merci beaucoup. Bonjour tout le monde. This is going to be, I'll be speaking on behalf of my colleagues from the Ottawa area hospitals, which include Bruyère, Montfort, Ottawa Hospital, the University of Ottawa Heart Institute, and Queensway Carleton Hospital. With the rising cases of COVID-19 in our community, Ottawa area adult hospitals are taking further actions to preserve critical care and human resource capacity. In line with the directive received from Ontario Health, adult hospitals in the Ottawa area are taking a planned approach to postpone some non-urgent and elective surgeries and procedures to allow us to continue provide care to all who need it. Comme ils l'ont fait tout au long de la pandémie de COVID-19, les hôpitaux sont toujours là pour prendre soin des patients et travaillent ensemble pour trouver des solutions afin de protéger la sécurité tout en continuant à offrir d'excellents soins pour tous. Une stratégie mise en place en ce moment implique de possibles transferts interhospitaliers, interrégionaux, afin que chaque lit de la région soit bien utilisé pour les bons patients au bon moment. Each hospital is currently evaluating and determining exactly how this will be implemented in their respective hospitals. Surgeries and procedures postponed will be selected on a select criteria to carefully consider the healthcare needs of patients while maintaining their safety. Cancer and urgent conditions, life and limb procedures will continue to be prioritized as they've always did. Les patients concernés par cette mesure seront informés par leurs équipes médicales dès que possible afin qu'ils disposent de toutes les informations nécessaires en temps opportun. Merci beaucoup.
Thank you, Dr. Roux. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We'll now start with CBC Ottawa's Trevor Pritchard.
Hi, thanks everyone. So with the announcement about the marginalized postal code communities and the 50+ vaccinations, I'm just wondering, do you think you're going to get enough supply from the province, and what do you foresee concern-wise if that doesn't pan out and people are trying to get vaccines and they can't in those neighborhoods?
Perhaps I can take that question. So the vaccine supply, as I mentioned at previous media availabilities, initially, as you know, was challenging. We weren't the supply was varying, but now it has been steady, and the outlook continues to be. And as I indicated, I'm more encouraged now that we can do better planning because we have supplies coming in regularly. It hasn't increased; it's increased a bit, but not significantly. So as we add these other groups, obviously it creates pressures amongst the different groups. But I think we're being told by the province that we'll start seeing more significant doses arrive. The other question is very much hypothetical because basically what happens is the vaccine that we do get, we ensure is made available. People can book their appointments, and when they arrive, the vaccine is there. And we run out of vaccine every week after our doses and our appointments are put up. So I'm actually encouraged that we are moving in the right direction, and the addition of these postal codes that the province have added, and the continued work that we're doing in the high priority areas that we've done since day one, will be able to continue.
Thanks. And then just on on a different note, given that it is spring break coming up, I'm wondering if somebody can just set out under the current rules, what can people do in terms of going to a cottage or crossing the river into Quebec and maybe hiking through Gatineau Park? What are the recommendations and what are the rules?
So the current recommendations under the stay-at-home order is we shouldn't be leaving our regions. It really truly is a stay-at-home order. That is the order. There are options here in Ottawa. There are parks. There are venues. You can walk around your block, etc. So no, you shouldn't be crossing the bridge to go to Quebec. You shouldn't be leaving, your neighborhood just to go and trance around in other areas. This is serious. I mean, Dr. Etches has described, Dr. Roux has described what's happening in our healthcare system. We again need all of us to assume our community responsibility and follow those rules. So please stay at home.
I could just add a comment to that as well. The Mayor of Gatineau and I have both agreed that we would encourage our residents to stay on our side of the border. The city of Ottawa is 2,600 square kilometers. It's a large piece of geography. We have lots of city and NCC trails on this side, as well as parkland. So we really encourage people not to go over to a cottage or to Gatineau Park. And just as the Mayor of Gatineau is encouraging his residents to stay on their side of the border, as you know, they've been extended their red category lockdown because they're seeing significantly high numbers as well. So our best advice is please respect the borders and stay within your community. Thank you.
Great. Thank you.
Thank you. We will now go to City News Ottawa's Eric O'Brien.
Good afternoon, everyone. My question is for Dr. Etches. You said it's more likely that schools will have to close coming out of the break. What's needed to keep them open? Or is it kind of a little bit too late for that?
We have no sign right now that the curve is turning. And it's all the indicators are showing things going up still. And so I want to give people notice so they can plan, so the educators can plan, families can plan after spring break. And so that's why, I think we're looking to make this decision, confirm it, the direction by Wednesday. So I'm not sure we're going to see the curve turn between now and Tuesday or Wednesday. So that's what we need. We need the curve to turn. So now is the time to really add in all of the measures. Closing schools is the last thing to do. It's an essential service for children and youth. We've got the stay-at-home order now. And so now, this is unfortunately the point that we've reached where we need to do everything possible.
Like you were saying with the letter you signed with the top doctors from Toronto and Peel, that you'd be looking into schools and the transmissions here in Ottawa. Are schools at that point where they're becoming a vector for transmission?
No, I'm actually, I don't see a big change this week in what's happening inside schools. So the number of outbreaks is about the same. The situation is still manageable by school staff and our public health staff in terms of following up with people who've tested positive, sending cohorts home. There's pressure there because it is more and more cohorts that are having to go home. But it's still a minority of schools where someone's testing positive. What's different is that we need people to stay home. And we see when people go out to school, there's mixing before and after school. People connect without masks, sometimes in close contact. When schools are closed, it sends a stronger message. This is serious, and we do need you to stay home. It is associated with strict measures that have turned the curve in other countries where the variants of concern are spreading. And so, I think the point is more about we all need to do everything we can to stay home. It's not that the schools themselves are out of control.
Thank you.
Thank you. We will now move on to CTV Ottawa's Josh Pringle.
Thank you very much and good afternoon. I'm just wondering if I can get some clarification on the postal codes. Can anyone 50 plus in the K1T, K1V, K2V register right now to get an appointment for a COVID-19 vaccine, or is it just people who are in the 21 neighborhoods that have been identified by Ottawa Public Health?
Your first statement is correct. That's our understanding. The province is the one that has opened up the provincial booking system according to those forward sortation areas. So my understanding is that that is now permitted. And when people go into the provincial booking system, they'll be able to book if there are appointments. So the actual number of appointments that you'll see that are there are based on how much vaccine we have. Now, they may be filling up or filled very soon, but we know that as more vaccine comes in, we'll continue to make more appointments available in the provincial booking system. So my understanding is that eligibility will continue as you described.
And my follow-up question, this morning in the media release sent out by the city, it said there was limited supply up until April 30th. Appointments will be available. Any indication right now when you'll get more supply to open up more appointments for people 50 plus in those neighborhoods?
Yeah, so in the provincial system, it's for anyone that wants to book either in those neighborhoods, but as well any of our mass vaccination clinics that are booked through the provincial system. So we now have over 80,000 appointment books till April 30th. We have approximately 5,000 left. So as Dr. Etches says, I suspect those will go fairly quickly. We generally get our vaccine on a weekly basis. and generally it's on Tuesday, sometimes it's Wednesday, depending. And we suspect and we have the understanding from the province that I mentioned earlier, things now seem to be running more smoothly, that we'll continue to get our vaccine allotments on a regular basis.
Thank you very much, and feel better, Dr. Etches.
Thank you. We will now move on to Global Ottawa's Craig Lord.
Thank you. I guess I had a question about the FSAs as well. The province moved to open up these so-called hotspot areas to 50 plus getting vaccinations, but Ottawa has long had its 21 high priority neighborhoods. Is there a bit of a disconnect between the province and the city on this, on where the city is prioritizing vaccinations? And given the limited supply of vaccines we have, is this counterproductive to be opening up 3 wide postal code areas rather than the targeted pop-up approach that the city's been doing?
There's overlap, right? So the large forward sortation areas do contain neighborhoods where rates have been higher, and we need to focus. So I don't see them as necessarily contradictory. It would be nice if there could be a more focused, circumscribed approach to geography. That's what we'll do locally. We'll continue to really use a neighborhood by neighborhood approach, so it's going to happen at the same time.
Thanks. I had a question, I guess, about the OPH dashboard. We saw this morning that the number of identified variants of concern and mutations jumped by almost 1,000 overnight. Is there any explanation behind that? Was there a data error that was resolved, or anything to explain why we're seeing so many more confirmed variants today?
Yes, I believe there's a new way that the samples are being processed, and this was something the provincial report from Public Health Ontario, also you could see the jump there in that this is reflecting a faster way to detect the variants of concern.
Thank you.
Thank you. On va maintenant à Julien Paquette avec le droit.
Bonjour. Docteur Etches, dans le passé, depuis un peu plus d'1 an maintenant, chaque fois qu'il y a eu une vague assez importante devant nous, à Ottawa, on a réussi à renverser ça de façon assez rapidement. Ça semble, vous l'avez dit plus tôt, il n'y a pas de signe que pour l'instant, on y arrive. Est-ce que quelque chose au-delà des variants qui a changé, ou ce sont vraiment les variants qui compliquent la situation à ce point-là?
C'est définitivement plus difficile aujourd'hui à cause de la variante de COVID-19. C'est clair que la transmission est plus haut, le taux de transmission est plus haut. Et c'est pourquoi c'est plus difficile. Et on a les outils qui peuvent fonctionner contre le variant, mais il faut être strict avec, par exemple, la transmission dehors. On veut avoir une situation dans les parcs où les gens peuvent apprécier l'extérieur, d'être actifs dehors, mais il faut garder la distance entre eux et porter les masques aussi. Si quelqu'un est dans un parc avec les autres dehors leur maison, leur foyer, c'est important d'ajouter les mesures comme ça, d'avoir plus de précautions.
Parfait. Peut-être que ça a été mentionné un peu plus tôt, là, je ne suis pas certain d'avoir saisi ce détail-là, mais ce matin, dans le communiqué, on semblait s'inquiéter ou on semblait prévoir que l'ensemble des rendez-vous disponibles pour la vaccination soit complètement pris rapidement. Est-ce que c'est le cas finalement? Est-ce qu'il y a encore des rendez-vous disponibles, ou on est déjà à attendre la prochaine livraison de doses?
On a actuellement, Julien, on a d'ici le 30 avril, sur les doses qu'on a, on a plus de 80 000 rendez-vous de prise et de déjà faits. Il nous reste à peu près 5 000 rendez-vous avant l'entrée dans cette conférence de presse-là, la dernière information que j'ai eue. Et je présume, avec l'ajout des 3 codes postales, les gens de 60 ans, etc., on continue à augmenter. Donc, ça devrait rapidement compléter. Et donc, oui, à ce moment-là, on doit attendre les prochaines arrivées pour être en mesure d'ouvrir d'autres rendez-vous.
Mais vous avez dit que c'était probablement mardi ou mercredi.
Oui, normalement, les mardis, on reçoit ou on a confirmation. Par contre, juste pour que ça soit clair, on a déjà la confirmation de ce qu'on va avoir d'ici le 30 avril. C'est plutôt plus loin que le 30 avril. C'est ces rendez-vous-là qui vont être ajoutés.
Tony, can you give that in English? I think those are some good stats that
Yeah. So, sure, Mayor, thank you. So just your colleague in French asked, so we're in a position right now, from now till the 30th of April, we have confirmation of what we get as vaccine. So that's what's in the booking system, the provincial booking system. There's 80,000 plus appointments that have been booked. From now to April 30th. We believe that there's approximately, before we entered the media scrum here, 5,000 additional bookings are available, but we suspect with the additional postal codes and still people 60 and over and others that are booking, those will go quickly. And that's just for the provincial booking system. I remind you, we have the pharmacies and soon we'll have the physicians as well. That continues, that's over and above. And so just to your colleague, so we know we have a vaccine to the 30th. After the 30th, as the province confirms to us what we're getting, those additional bookings will be added to the system, but it'll be after April 30th.
Merci. We will now go to the Ottawa citizens, Taylor Blewett.
Thanks so much. I want to ask, first of all, why you're opening vaccine pre-registration to those moderate priority or non-frontline healthcare workers. I did see it was noted that, you asked that to help protect those in communities who are more at risk. You do ask those who are able to work remotely to consider waiting until they're eligible based on other factors so that, those in the most impacted communities can be vaccinated sooner. So why even give them the option? Why not focus on other, say, frontline workers or other phase 2 eligibility groups?
Maybe Tony wants me to answer this because it's related to healthcare workers. In all aspects of this vaccination program, we're following provincial direction. And the provincial direction was to vaccinate all healthcare workers in phase 1. Now, we started with people who were working on COVID units in hospitals. And we started with the workers in long-term care homes and retirement homes. So we're taking a risk-based approach and we moved out from there. Now we've passed through the family doctors that are seeing patients, and we still have hospital workers who go into the hospital every day who are not immunized. And we have outbreaks in hospitals. We have 10 outbreaks right now in hospitals. And so even the staff that work on communications or in other, aspects of the hospital, but not patient care, are potentially at risk. And so we need hospitals to function. We need these staff to be protected. Now, what we do have control over locally is how we sequence people within this group of moderate priority. I believe they're called moderate priority healthcare workers. What we're doing is we're going to put anybody who's working from home at the back of the line. And we do control how much vaccine can be allocated to this group at once because we are allocating across all these other priorities. People who are housebound, people who are in congregate settings, people who are living in higher risk neighborhoods. So it's not a large quantity of vaccine that we are allocating to moderate priority healthcare workers. And we will proceed through the lists that are approved. The other thing that's happening is sometimes the province gives us another priority. And for example, the special education teachers are a new priority that was mentioned by the Premier. and we are moving them through the Ottawa Hospital and the Queensway Carleton clinics ahead of moderate risk or moderate priority healthcare workers. So we'll continue to do that as the province gives us direction.
And when it comes to those, end of day doses that might be available, I know it's been said before that, healthcare workers are being offered those doses on kind of a last minute basis. Is that only frontline healthcare workers who are getting that call, getting that option? And, if not, why not use those doses for other frontline workers or priority groups that are eligible right now?
Sorry, I'm having trouble on mute there. So yeah, there seems to be this urban legend that we have significant amounts of end of day vaccine. You're correct. There are at end of day, sometimes in a clinic, 1 or 2 vaccines that may be left over. And so each of those clinics have people working in those clinics that are at high risk or part of the eligibility groups. And those are the ones that are put through. At the hospital, a little simpler. You're in a healthcare institution, so they can be brought down. But these aren't big numbers. And what we attempt to do is, in each of these circumstances, try to ensure that those vaccines are given to the priority group. So it's not going to somebody like me that's working at home. I wouldn't be eligible for that. And so I can tell you it's very limited numbers in spite of what people think. And it is always given, or we always attempt to give it to those priority groups. And because it is important and we understand what has to be done here.
Thanks.
Thank you. We will now move on to the Ottawa Sun's John Willing.
Thanks, Seb. Question for Dr. Etches. I hear your warning about schools after spring break. What is your current thinking on childcare centers?
These are the kinds of details we want to work out so that we have everything clear and able to be confirmed for people next week. I think you could anticipate something like we saw in Toronto, where the childcare options for school-age children are included in the the direction to cease in-person contact and stay at home. But in Toronto, they did not include childcare for children younger than school age. And so these are the kinds of things we're looking at, and we'll work with our city colleagues in the Community and Social Services Department to make sure that we are considering the needs for childcare.
Thanks, Doctor. I'm wondering, as more people get partially vaccinated, especially grandparents now with the older folks, I wonder if there's going to be more of a growing interest for families to get together. And you're certainly hearing this dialogue happening in the community as more people get vaccinated. And so I heard Councillor Aguilar's comments about still keeping those precautions. How is that being communicated to people who get the vaccines? When people get the vaccine, are they told what the guidelines are about masking, distancing going forward?
John, I think you're giving us a little bit of investigative work to do in terms of how that's communicated, whether you're at your doctor's office or a hospital or a pharmacy or a public health clinic. I think we need to take a look to make sure people are hearing the same message, which is that we will get to a point where people who are immunized will have more freedom when there's a little bit more evidence of more herd immunity, and we know that these days are coming. We anticipate, like the province has said, by the end of the stay-at-home order, we'll probably have 40% of our population immunized, and so we'll continue to update the guidance to people who have been vaccinated. But at this point, we need everyone to do their part around really upholding that protection in public spaces that involves the mask use and the distancing, it's just there's a really high level of COVID still in our community. There's not 100% protection from a first dose. Most people will have their fully vaccinated status won't come for a number of months, right? So, but I know people are looking for guidance, and we'll continue to update that.
And John, if I can just jump in further to what I said, you know, the media has been a great partner in getting the messages out that we need to get out. So I think we've all mentioned in one way or another that we have to continue to do those things, the face masks and the physical distancing. So we're hoping that good partnership we have with you and your colleagues will continue, and that can be shared out after the media avail as well. Thank you.
Thank you both.
Thank you. On va maintenant à Rémi Autier avec Radio-Canada.
Bonjour, merci beaucoup pour votre temps. J'aimerais entendre, je ne sais pas si c'est le maire Watson ou Dr. Vera-Etches, mais quand on regarde la carte du nombre de cas depuis le début de la pandémie, les endroits les plus touchés, il n'y a aucun des quartiers qui sont considérés des hotspots, qui sont considérés prioritaires. Les quartiers prioritaires par la province ne semblent aucunement liés au lieu où il y a le plus de cas. Comment vous expliquez cette situation qui fait en sorte que des quartiers comme Vanier, où il y a énormément de cas, ne sont pas prioritaires, tandis que des quartiers comme des coins comme Canada ou Gloucester, South Nepean, eux, sont vus comme étant prioritaires?
Je voudrais commencer et peut-être après le maire peut ajouter quelque chose parce que c'est une question de mathématiques. Quand on a une grande géographie et on a une moyenne, un nombre de cas, c'est cacher les différences entre différents quartiers dans cette grande géographie. Alors, pour quelques raisons, les géographies identifiées par la province sont là avec leurs chiffres. Mais pour nous, parce qu'on examinait notre géographie avec une approche plus détaillée, on peut voir les différences dans les différents quartiers. Et avec cette information locale, on utilise un peu une différente approche, mais ce n'est pas complètement différent. Il y a un lien entre quelques géographies, la grande géographie et les quartiers. C'est le même pour, par exemple, Vanier. Peut-être Vanier est près d'un autre quartier plus avantagé. Alors, quand on regarde les deux ensemble, le moyen peut-être est plus bas. Est-ce que c'est clair? On peut expliquer? C'est une question de mathématiques et où sont les lignes pour la géographie?
Je comprends, mais ce que je ne comprends pas, c'est que dans votre explication, on dirait que le gouvernement provincial ne vous a pas consulté et il a décidé, voilà là où c'est prioritaire, tandis que est-ce que la ville d'Ottawa a été consultée? Est-ce que vous avez quelque chose à dire sur où vont les vaccins dans votre propre ville?
Oui, j'ai expliqué à la province que nous avons une approche un peu différente pour notre quartier et la province m'a soutenu de continuer avec l'approche ici à Ottawa.
Et peut-être, Rémi, je vais donner un autre commentaire. Comme j'ai dit pendant mon discours, j'ai écrit une lettre à le remplacement pour General Hillier pour dire ce n'est pas juste parce qu'on n'avait pas des pharmacies dans Vanier, par exemple. Et ça, ce n'est pas correct. Et j'espère qu'il va corriger cette situation pour les résidents de ce quartier. Par exemple, il y a 2 centres pour les Autochtones à Wabano et Saint-Laurent dans cette quartier. Et ça, c'est une décision de santé publique d'Ottawa de créer cet lien, partenariat avec Wabano et pour les résidents qui sont autochtones, qui habitent dans l'est de la ville. Mais vous avez raison, et il n'y a pas de consultation en avant. Et ça, c'est la raison que j'ai écrit une lettre à le colonel qui est responsable pour ça, pour corriger la situation spécifiquement avec des pharmacies. Comme Dr. Etches a dit, le problème avec les codes postales, Vanier est situé juste à côté de Rockcliffe et Linden Lee, Et il n'y a pas de grands défis dans ces quartiers, mais il y a des grands besoins à Vanier et Overbrook Forbes. Alors, pour utiliser seulement le code postal, ça pose des difficultés pour notre personnel parce que c'est une décision de la province. Merci.
Pour mon follow-up, je fais juste un rapide follow-up. Monsieur Watson, vous avez parlé d'un nombre de personnes vaccinées à ce jour ou aujourd'hui, puis je pense que j'ai entendu un autre chiffre de la part de Monsieur Dimonte. Pouvez-vous nous clarifier, là, à ce point-ci, on est rendu où dans la vaccination? Est-ce que vous atteignez vos objectifs ou est-ce qu'on est en retard? Comment ça se passe? Juste me donner, définir ça, là.
Peut-être je peux vous donner le chiffre et laisser le maire commenter par la suite. On a 186 000 personnes de vaccinées. En ce qui concerne notre objectif, c'est lorsqu'on a du vaccin, c'est d'assurer que l'ensemble du vaccin est mis dans les bras des gens en vertu des priorités qui sont identifiées et par la province et par le Dr. Etches et la discussion que vous venez juste d'avoir au niveau des secteurs prioritaires, ainsi que les personnes âgées. Donc, je vous dirais que oui, à la fin de chaque semaine, il nous reste plus rien et on attend notre prochaine livraison. Donc, c'est ça pour moi qui mesure notre objectif, qui est le plus important. Mais si le maire veut rajouter, je lui laisse céder la parole.
Non, c'est correct. Il faut que je quitte pour un autre Zoom call avec le comité des petites entreprises. Alors, merci beaucoup.
Merci, Maire. Et je voudrais ajouter que nous avons un site web avec tous les noms concernant le programme de vaccination. C'est disponible au public, santépubliqueottawa.ca. Il y a un site, je pense, les chiffres sont là de nouveau chaque lundi, mercredi et vendredi.
Merci beaucoup.
Merci. On va maintenant à TVA Nouvelles et Kenza Beladi.
Bonjour, est-ce que vous m'entendez bien?
Oui, on t'entend.
Donc, ma question sera pour Mme Etches. Vous avez déjà, Dr. Etches, vous avez déjà répondu à la question en anglais. Je voulais juste avoir une version francophone. Par rapport aux écoles, là, vous dites que les probabilités que les écoles soient ouvertes après la pause du mois d'avril sont très faibles. Est-ce qu'on peut faire quelque chose là, pour remédier à la situation? C'est pas mal sûr que ça va arriver, là.
La raison pour la vie aujourd'hui que c'est pas probable que les écoles vont fermer ou changer l'éducation virtuelle après la semaine de congé, c'est parce qu'il n'y a pas un signe de la courbe tourne. Et c'est difficile de voir un changement entre aujourd'hui et la semaine prochaine, le mardi, mercredi, quand il faut donner la confirmation pour donner le temps pour préparation pour les familles et les éducateurs. Alors, on va continuer comme cette semaine de regarder les chiffres et les tendances chaque jour, mais avec l'ordre de rester chez eux qui est maintenant en place, c'est possible d'éviter le problème avec quand les écoles sont fermées, les gens vont au centre d'achat, par exemple. Et c'est important avec le niveau de COVID d'utiliser toutes les mesures on peut pour tourner la courbe, d'assurer que les gens restent chez eux.
Merci, c'est tout de mon côté.
Merci. We will now go to Sue Sharon. Sue? Sue, I think you're on mute.
Can you hear me now?
We sure can. You can go ahead with your questions.
That's a phrase we've heard most over this past year. Dr. Etches, I mean, obviously this is, you know, these are tough times. Are there things that maybe the public should be aware of? I mean, if things get worse, what else can the health department do to clamp down on this further than trying to encourage people to stay at home and wear masks? Like, how much worse could it get for the public if they don't bring the numbers down?
I really would actually like to offer a chance for Stefan, Dr. Roux to speak, because that is where we're seeing the greatest challenge right now is in our hospitals. And it's what people will feel in terms of less access to the procedures they need and potentially more younger people in hospital in an intensive care unit. So I would like people to understand that this is, we've said a few times, the hospitals are under pressure, we need to turn the curve, and people did. And so the hospitals never reached this point again since last March, where they had to start really these challenging decisions, but they're there now. This is where we're at. And if you take a look at the greater Toronto area, it's pretty concerning, that picture. And they've had variants of concern for a couple more weeks, few more weeks than we have at higher levels, but it's coming here, right? So we will reach that point if we don't do our part to keep distance. That's the basics, keep distant from other people in our household. And that means staying home as much as possible. When you're outdoors, keep distant. So Dr. Roux, I don't know if you want to add anything.
Yes, Dr. HS, thank you very much. I cannot emphasize enough, as you just mentioned, the importance of respecting those directives from public health. As you just mentioned, exactly. We're very concerned at this point in the hospitals with our capacity to be able to treat everybody that will come to our doors in the near future if the cases keep going up. We see younger and younger people in our emergency rooms, in our ICUs, and we have less staff and beds right now at this point to be able to manage and provide the care required for everybody. So right now we're good. We're able to manage, and we work as a region to be able to use every bed in the region for people. So we maintain our critical care capacity, but we definitely don't want to go to the point where and reach that point where we have to make choices between who gets a respirator or who gets that ICU bed, intensive care unit beds, and who doesn't. So that's what is at stake for us right now. We want to treat everybody. Everybody deserves the right to be treated to the highest standards. And right now, we're concerned that we may lose that capacity if our hospitals become overwhelmed with increased cases.
Est-ce que vous pouvez dire ça en français, ça ne vous dérange pas?
OK, oui. Ce qui nous inquiète beaucoup au niveau des hôpitaux actuellement, c'est notre capacité de pouvoir soigner tout le monde qui vont se présenter aux portes de nos urgences ou dans nos salles d'opération. Actuellement, avec la montée des cas qu'on voit dans la région et qu'on voit ailleurs dans la province et dans le monde, on est inquiet de ne pas être capable, dans un futur rapproché, d'offrir, par exemple, des respirateurs ou d'offrir un lit de soins intensifs à tout le personnel qui pourrait, ou à tous les patients qui pourraient en avoir de besoin. Donc, pour nous, c'est une inquiétude majeure et c'est sur ça qu'au niveau de la région, on est à travailler, tous les hôpitaux ensemble au niveau régional et même provincial, à utiliser chaque lit qu'on a de soins intensifs dans la région, chaque lit de soins critiques pour pouvoir être capable d'offrir ces soins-là. On ne veut surtout pas en arriver au point où le personnel de la santé va devoir choisir qui va recevoir les soins et qui ne pourra pas recevoir les soins. Donc, c'est pour ça qu'on veut que c'est si important le message de la santé publique et que pour les gens, chaque petit geste compte pour nous. Et puis, chaque action que chaque individu peut prendre pour prévenir la propagation de la COVID, ben pour nous, ben ça nous donne une chance de plus de pouvoir continuer à traiter tout le monde au niveau de soins qu'il mérite.
And as a follow-up, Dr. Etches, you've spoken in the past about the, the emotional toll, the physical toll this is taking on people. You said today, like, we're hitting the wall. I can't help but wonder if you're not feeling well. is in part due to you having way too much on your shoulders and trying to protect us all, but then you come down with something.
You know, it is interesting that our family got hit by a virus, a respiratory virus. It was not COVID, because we haven't seen respiratory viruses other than COVID circulating for a long time. So if you ask CHIO, what respiratory viruses did they see through the winter? Where normally they'd have flu, they'd have all kinds of respiratory syncytial virus, lots of different viruses. They saw nothing this year because people were distanced and they were wearing masks. But now there are some more viruses showing up. CHIO has been finding some enteroviruses and rhinoviruses and probably something like what we've had because we're just a little too relaxed. We have to go back to being really strict right now. Wear those masks, keep that distance, and we can stop COVID. We've done it. It will happen. But those signs that we've just relaxed a bit too much are there. And so I just ask people to hang in. We'll get everyone vaccinated. We will do it fast as we can. It's coming.
Thanks so much. Take care.
All right. Thank you, everyone, for your time today. Merci à tous. Have a nice Friday.
It's hard to know.